Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over what a Baker cyst is and really what causes it. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So what is a Baker's cyst? So it is a fluid-filled growth behind the knee, okay? So it does get quite tight. It kind of bulges at the back of the knee there. It's also sometimes called a popliteal cyst because the knee is called the popliteal. So it is sometimes called that. It can also cause pain. So it can feel like pain or tightness at the back of the leg there, right behind the knee. It can get worse with activities where you're straightening and bending the leg. And then the Baker cyst, it usually is a result of a problem with either the knee joint, arthritis, or a cartilage tear. Okay, so your body starts creating too much fluid for the knee, which creates this fluid-filled growth behind the knee. So although a Baker cyst, it may cause swelling and discomfort, treating the underlying cause normally provides you relief. So symptoms. So sometimes a Baker cyst causes pain and sometimes it does not. So some people don't even really have symptoms in mild cases, okay? But for the people who do have symptoms, they'll have swelling behind the knee, tightening, pain, stiffness. Symptoms may be worse on activity or if you have been standing for too long. So we've kind of already touched base on this, but what causes a Baker cyst? So the lubricating fluid, it's called synovial fluid. It helps the leg move, okay? That knee joint move, it lubricates it. So with underlying conditions, sometimes too much synovial fluid will be created, okay? So when this happens, it builds up at the back of the knee, leading to that Baker's cyst, okay? So this can be caused by inflammation of the knee joint in different types of arthritis, or a knee injury or cartilage tear. So complications of a Baker cyst. So it happens rarely, but sometimes a Baker cyst can burst and the synovial fluid will leak out into the calf region. So this will create a sharp pain in the knee. You could have swelling in the calf area and sometimes redness of the calf or feeling like water is running down the calf. So diagnosing, normally it can just be diagnosed during a physical exam. However, some of the symptoms of a Baker's cyst are similar to more serious conditions, okay, such as a blood clot, aneurysm, or tumor. So your doctor may want to order more specific tests if they are not 100% sure. So they can order a ultrasound, x-ray, or MRI. Now treatments. Mild to moderate Baker cysts, they will just kind of let them dissipate on their own. It's normally controlled by just reducing activity or whatever is causing the Baker cyst, okay? However, with larger Baker cysts that do cause a lot of pain, they may need treatment. We'll just talk about it here in just a second. So some different therapies that they will try. So first they'll, depending on the signs and symptoms, once again, medication. So Tylenol, so acetaminophen or ibuprofen can help reduce the pain and inflammation. They may do cortisone shots in the knee to reduce inflammation, okay? They might do therapy. So gentle exercises that improve range of motion can help restore and preserve the knee function. And then we have surgery or other procedures. So to reduce the size of the cyst, they may drain the fluid from the cyst, okay? So this is called a needle aspiration where they pull out the fluid. It's normally guided through ultrasound. If the joint is the problem, or say the cartilage tear, they're going to go in and fix this, okay? Or it's just going to be a recurrent problem and the fluid will just keep building up. So we need to fix the issue that's causing the fluid to build up, okay? It's always, even in wound care, we always have to fix the problem before we can fix what's actually going on, like what it's causing, okay? So you're always fixing the problem to fix what it's caused. Rarely surgery is needed to remove a cyst. So a Baker's cyst, it doesn't have like a capsule like a normal cyst does, okay? So it's not really an approach that they use, but they do sometimes do this if other things are not working, okay? So when are we going to see the doctor? So anytime you have pain or swelling behind your knee, you should go see the doctor, okay? It can be a sign of a blood clot in a vein, in one of your leg veins. So you would want to get this checked out, so you can have treatment, okay? And then on the other hand, like I said, it might not even be a blood clot, and it could just be the Baker's cyst, and you would still want to have the doctor check that out, okay? And they can tell you if it's a mild, moderate, or we need to do something to take care of this right away, okay? It's better to have it checked out than not. So that's all I had for this video. I hope it did give you a better understanding of what a Baker's cyst is and how we treat it. But that's all I have for this video, guys. I hope to catch you in my next one, and I hope you have a wonderful day.